History taking of a bedside patient. Before taking the history of a patient, there are some rules that we maintain during the process. First being stand on the right side of the patient. Second one is to greet the patient by saying hi, hello, namaste, assalamu alaikum. And the third one is to introduce yourself, that my name is Dr. Sans and I'm your today's doctor. I'll be asking you some questions and taking your history today. Fourth is the most important one, that is to take the consent or permission from the patient and assuring them that you will not be causing them any harm or giving them any pain. We can do this all in a single statement by saying Namaste, Assalamu alaikum, my name is Dr. Sans and I am your today's doctor. I'll be asking you some questions and taking your history, and I'll not give you any pain or harm or any trouble. If you feel any trouble, you can please let me know or inform me. Once the consent is given by the patient, we can proceed asking them questions starting with the particulars of the patient. Here, we ask the patient their name, age, sex, religion, marital status, occupation, temporary address, permanent address, date of admission, date of examination, bed number, and if the patient is pediatric patient, then we ask for their source of informant, means the one who is giving history on behalf of their patient or baby. Then comes presenting illness or the chief complaints. Here, we ask the patient about their main illness or complaints for which he or she was admitted into the hospital. Now, here again we have some rules for writing the presenting illness. Like first one being, the points should not be more than 2 or 3 and minimum it should be 1. Now the second one is, it should be written in the patient own words, whatever they say or explain, and it should not include any medical terms or terminologies. Now the third rule is, it should be written in the order of either severity of illness or in the order of duration. For example, let's say a patient came to the hospital with the complaints of fever and vomiting and diarrhea. Then we will ask them which one is the most severe one for which he or she was admitted to the hospital. We will write that one first, then the second and the third. Let's say second example, a patient came with the complaint of fever, cough, breathlessness and chest pain. Then we will ask them which one is the most severe one. If the patient says chest pain is the most severe one for which he came to the hospital, then we will write the chest pain first. Now, the history of presenting illness. Here, we elaborate the history of illness that we have mentioned earlier or the complaints that patient come up with. So, it varies from disease to disease. For example, let's say if a patient come up with the complaint of fever, then we have a different elaboration for the history of fever. If the patient come up with the complaint of pain, then we have a different elaboration for the history of pain. And same goes with the history of breathlessness, asthma, COPD, diarrhea, cough, unconsciousness, and etc. To understand this, it is important to elaborate the history of patient's illness as it helps us to approach our case towards a specific diagnosis. This means that, let's say if a patient come up with the complaint of fever or a high temperature, then as a doctor, we cannot just simply say the patient has fever, but we need to know what kind of fever it is and what is the causative agent behind this. Like we need to find out either it is viral fever, enteric fever, malarial fever, meningitis, kala jar, or tuberculosis fever, or any sort of inflammatory reaction. Similarly, if a patient comes up with the complaint of pain, then we need to know what kind of pain it is. Like either it is musculoskeletal pain, cardiac pain, or any visceral pain like appendicitis, cholecystitis, etc. And same goes with the history of unconsciousness. It can be syncope, stroke, transient ischemic attack, or unconsciousness due to heat stroke. We will learn about the elaboration of the different disease in a different video. So now, let's come up to the history of past illness. In the history of past illness, we ask the patient and write about their past history if he or she had suffered from similar illness before or any other severe disease for which he or she was admitted to the hospital. And along with this, we must ask them if they have disease like diabetes mellitus, thyroid, asthma, COPD, or any other congenital diseases. It is important for us to take the past history of the patient because it helps us to connect the dots and find out the connection between their present and past illness. So here, for example, if a patient had a history of similar illness in their past, then we write the patient had a history of similar illness 2 years back or certain time back. Now, if the patient had conditions like diabetes mellitus, hypertension, thyroid, asthma, COPD, then we mention it over here, and even if they do not have this condition, then we still have to mention it that the patient have no diabetes mellitus, hypertension, thyroid or asthma or COPD. Or if the patient had no significant history in the past of any illness, then we write not so significant or no significant findings. Now comes the drug history. It is important to know the drug history of the patient, as there can be some disease that are induced due to the intake of some drugs. So here in the drug history, we ask the patient if he or she has been taking any medication on a regular basis for any sort of illness like insulin for the diabetes mellitus, antihypertensive drugs for the hypertension, inhaler for the asthma. And we should also ask the patient that if he or she has been taking any medication by themselves for their current illness before being admitted to the hospital. For example, paracetamol for the fever, painkillers for the pain, antiemetics for the vomiting, etc. Or if the patient have no significant history of medication, then we simply write not so significant or no significant findings. Now the familial history. In the family history, we write about the disease that their family member may have, either mother, father, which may or may not be transferred into the patient genetically. For example, let's say any heart disease like myocardial infarction or thyroid disease or diabetes mellitus, asthma. These are some diseases that can be transferred genetically from the parents to offspring. For example, let's say if one of the parents of the patient has any disease like hypertension, asthma, diabetes, thyroid, then we write the mother has hypertension, asthma, and or the father has diabetes, thyroid, etc. And if the parents has a clean and healthy history, then we can simply write not so significant. Now the allergic history. In the allergic history, we ask the patient if he or she has any history of allergy with things like dust or any sort of food like prawns, mushroom, peanuts, etc. And if the patient has no history of allergy, then once again we can simply write not so significant or no significant findings. Now the immunization history. Here in the immunization history, we ask the patient if he or she is immunized according to the EPI schedule, which means expanded program on immunization, which contains vaccination against 9 to 10 diseases, and they are tuberculosis, polio, diphtheria, pertussis, tetanus, measles, hepatitis B, pneumococcal conjugate, and rotavirus. So here we write he or she is immunized according to the EPI schedule and against the COVID-19. Now comes the very important traveling history. Travel history is one of the important history because sometimes the illness or the disease that patient is presented with, it may be associated with one of their recent travel to any places. For example, let's say a patient came to us with the complaint of fever and he has a recent travel history to places maybe malarial risk zone or a dengue risk zone or a Kala-Azar sandfly risk zone, then it will help us to find the real cause of the fever. Like a patient with fever with a recent travel history to malarial risk zone may indicate it is a malaria. Similarly, a patient with loose motion came to us with a recent travel history to a place like party, function or an unhygienic contaminated place, then it may indicate food poison induced diarrhea. So if a patient has a positive travel history, then we can write he or she has a travel history to ... place about ... days ago. Or if they do not have any travel history, then we can simply write not so significant. Personal history. Personal history is slightly tough and challenging to get from any patient since not every patient easily and openly share about their bad habits, addictions, intoxications, and sometimes they even try to lie. So we have to keep asking again and again and reassuring that they are speaking the truth. So here we ask the patient about their personal day-to-day habits and if he or she has a history of something like cigarettes, alcohol, betel leaf chewing, betel nut chewing or tobacco or anything that may be a cause behind their deadliest disease. So if the patient has any of those history, like let's say smoking, alcoholism and betel leaf chewing, then we can write he or she is a chronic smoker and he is a chronic alcoholic and he is a betel leaf chewer. Or if not, then we can write he is a non-smoker, non-alcoholic, non-betel leaf chewer, or we can simply write not so significant. Now the socioeconomic history. In the socioeconomic history, we try to access the lifestyle and the financial status of the patient, that in what condition and surrounding are they living in, but not by directly approaching the patient with the straight questions, but in a way that it does not sound offensive to the patient party. For example, we ask them what kind of house do they live in, cemented or non-cemented house, what kind of drinking water supply do they have in their home, like tap water or the fresh mineral water, what is the average monthly or yearly income of the whole family, etc. So let's say if a patient belongs to a middle class family, then we can write he or she belongs to a middle socio-economic family. If they have a safe and fresh drinking water supply in their house, then we can write he or she have a safe and fresh drinking water supply in their home. And it is important to mention these points because sometimes the unhygienic water supply in their home can be a reason behind the various diseases like enteric fever, diarrhea, etc. And knowing the economic condition is important so that the doctor can prescribe a affordable investigation and a affordable prescription. Now, lastly, in case of a female patient, menstrual history is important. In this, we ask a female patient when was her last period date and was the flow of blood regular and normal or not. And if everything was normal, then we can simply write her menstrual cycle is regular and normal. So that is all about the taking history of an bedside patient. I hope the video was helpful to you all. Thank you so much for watching.